My name is Matthew R. Weir. I'm a physician and I'm a professor of medicine and director of the Division of Nephrology here at the University of Maryland School of Medicine. Nephrology has to do with the care of people with kidney disease, and my major interest within that subspecialty is primarily people who have received kidney transplants. Not only people who have chronic kidney disease progressing to needing a kidney transplant, but also once they've already received it. We do much, much more than simply transplant kidneys. The whole process of identifying proper donors, making sure that recipients are sufficiently healthy to undergo an elective surgical procedure, we spend great time and care in focusing on that. The other thing that we try to do is we have a goal here of having every kidney serve their owner for their remaining life expectancy. This is really the critical factor. Believe it or not, end-stage kidney disease due to kidney transplant failure is the fourth leading cause of kidney failure in the United States. So our goal is to have not only every patient live longer, which is one big area of interest of mine, but also to be sure that every kidney serves their owner as best possible for their remaining life expectancy. So that, in a nutshell, provides, I think, important perspective on what makes us different here and why we can provide so much more than simply putting in the kidney, giving you the drugs, and seeing how you do. Well, I have a couple of big interests that I like to focus on in people who have had kidney transplants. One, we want to prevent progression of heart disease. Now, some people may ask, why heart disease? Well, people with kidney disease have an accelerated risk for heart disease. And although a kidney transplant markedly reduces the risk for heart disease progression compared to remaining on dialysis, it by no means extinguishes it. So we go the extra mile to monitor our patients carefully with regard to blood pressure, cholesterol. We really are very careful about antiplatelet drugs. We have all sorts of different strategies to modify the rate of progression of cardiovascular disease. In addition to that, the other big interest we have is medication safety in our transplant patients. We have an active program right now to develop health information technology to help patients have easy access through the computer, their smartphone, or even their standard telephone so that they can know more about the medications that they are being prescribed, especially if they are by doctors that aren't familiar with kidney transplant patients, so that we can prevent medication interactions and obviously illnesses that may derive from using medications inappropriately in our kidney transplant patients. The thing that excites me the most is to see the veil of illness being lifted off of somebody with chronic kidney disease once we restore their renal function. It's remarkable. Whether you're 25 or 75, you're a whole new person once we've done a successful kidney transplant. And I've been doing this for more than 30 years. I never get tired of seeing this happen. I love to tell patients about it. It really makes a difference. I'm very interested in charitable work. We do quite a bit of work in our family for the National Kidney Foundation and the Juvenile Diabetes Research Foundation. I'm also making a lot of effort to raise money for our School of Medicine to facilitate biomedical research and educational programs for both patients as well as for young trainees who will be the future doctors of America. And to me, that's probably the most exciting thing I can do, is to, in a sense, put more fuel and energy back into the system that I grew up in.